we ask if you can just keep the questions general today, not go into specifics. If you do have a question around any personal details, then perhaps do that after the forum with your service coordinator or directly with Mira or I or other leaders in the service as well. Yeah, so we'll go from there. So from a COVID-19 update, just generally, there's certainly been a lot of good news in South Australia, particularly as we look internationally, particularly, but also in some of our eastern states. There's probably been a lot more cases in that space. Thank you for your understanding as we've kind of worked through that as a service, try and do what is appropriate. Sorry. And trying to comply with SA and national guidelines as they've kind of come through. We're continuing to talk to all our staff about that and keeping them up to date on the processes. And clearly a number of the practices still remain in terms of the good work around hygiene, particularly hand washing and social distancing, coughing and sneezing and testing and that like. Sorry, I'm going to have to throw to Muriel, otherwise I'm going to choke on something. Sorry.
That's all right. No worries at all. Joe was just demonstrating how to appropriately cough for everybody, so that's good. We've had good practice over the last little while. So we are still working to keep you up to date by SMS and an email if we have your details around the COVID space and how we're sort of operating. So all of our updates are also on the Accommodation Services Family Update webpage. So hopefully by now you all have access to that. So that's www.dhs.sa.gov.au/family update. And I'm sure Toby could put that on the chat so everybody would have that sort of directly. You okay, Joe? Do you want to? Will I keep going?
Sorry about that, everybody. It happens at the worst times, isn't it? So, look, just really wanted to say we are still progressing through that. Muriel will take us through now around some of the work that we're doing around exemptions and I guess gradually moving to this stage 2 as it is in the community, looking at how that can work in our service and work with other providers, particularly our day activities providers, and work around that. We're not sure where this is heading. Clearly, we're working very closely with health around any second waves in that space, but we as a state have done really well in managing the COVID outbreak. So we're really keen to make sure that we get back as much as we can to a normality and move away from the stage 1 approach. So I'll hand over to you, Muriel, and you can go through the next. Sorry.
No problems. So look, thanks, Joe. So look, just talking through exemptions. So last time we talked about some exemptions being in place for some of the people we support, for example, allowing them to go to work if it is safe for them to do so. So at this stage, we're continuing with these exemptions to help really protect people and to slow the spread of the virus. So we're really keen to know where everyone is, so as we can engage in adequate tracing, should anyone come in contact with COVID-19. So we're keen to take your feedback and wishes into account for you and your family and friends as we move forward into this next stage 2, as Joe said. Our positive behaviour support team is still working closely with staff in the houses on support strategies to help people to cope at this time, because we're not quite back to normal yet. So we still are obviously still engaging in social distancing and all of the things that we had in place in stage 1. So our positive behaviour support team are still very closely aligned with the staff and with the houses. If you have any concerns around exemptions that might be in place for your loved one, please talk to us about that. And the exemption, although that's the term that we have been using, it doesn't actually preclude anyone from going out or anything like that. It's just around us making sure that we have an adequate risk assessment to make sure that we know, that people understand how they need to behave in the community and all of those sorts of things. So we also talked last time about our staff gradually returning to offices and also visiting houses again where it's safe and sensible to do so. So again, we are still working through that. Most of our area managers are still working from home, with some of our area managers in the office maybe 1 to 2 days a week. And I'm in a similar position myself. So today I'm actually at Highgate Park with some of the leadership team, and we've you know, just we're continuing to sort of meet, but you know, using obviously social distancing, etc. We haven't started to go visiting the houses just yet, only where that's necessary. So if an area manager needs to attend a house for whatever reason, they'll do so, but they haven't started to go back to their original schedule just yet, because we just want to be sure that we're not overloading houses with people coming and going. And we are still monitoring the comings and goings of each house. So you are still asked to, anyone who is entering a house still needs to log that on the iPad that's on each of the houses on entry. So Joe mentioned day option providers earlier. So the providers of day activities and employment for the people we support have been asked to prepare a plan about how things can be done safely with focused outcomes and when they're ready to resume services. So we're working with all of the day providers individually to work through safe return to day provision. That will look perhaps a little bit different than it did pre-COVID. So just taking into consideration the various stages and the various numbers that can take part in the various activities. So this will ideally consider social distancing, tracing arrangements, the continued hand washing and good hygiene, as well as the expectation that if anyone is sick or has any sort of flu-like symptoms or scratchy throats, anything like that, that they will stay at home. Good planning by providers will assist individual conversations within homes to negotiate how services can safely resume. We will send you more information on this as details are confirmed by the various providers. And obviously they also need to think about transportation and safe transportation of people to and fro the homes. So it has been great to hear about the many phone calls and video calls using the house iPads to help you and your family member or friends stay connected throughout this COVID-19 period. And we're really keen to continue that engagement because I know it's not always possible to visit, you know, every day or to visit as often as sometimes we would like to. So yeah, let's continue using the technology to stay connected. And last time Joe and I caught up with you, some of you said that you'd like to use Zoom to video call the houses. So straight after that meeting, we actually had Zoom installed in all of the house iPads. So hopefully that was in place in time for Mother's Day. That was certainly our aim. And we had some really good feedback and some lovely pictures of people Zooming in with their families on Mother's Day, which was really, really lovely. Just as many of us are learning how to use the technology and video calls at this time, please bear with our staff who might also find Zoom a little challenging to use. Everyone's doing their best, and I think, you know, we're 10, 11 weeks into this now, and I think 11 weeks ago we could probably never have imagined having these sessions like this on Zoom with all of you. So we, as Joe said, the first session was a bit clunky. We got a little bit better on the second session, and other than poor Joe almost choking there a minute ago, I mean, I think we hopefully this won't be too bad of a third attempt. So as well as the technology, we are also encouraging you to visit the houses, you know, again, exercising the social distancing rules and the number of people who are coming to visit. So respecting the social distancing and following the state guidelines. Like I said, when you do visit, there will be this short survey that you'll need to complete with staff of the house, and that's for tracing reasons. And you just have to do that once a day when you visit the houses. So we are trying to, as much as possible, get back into our normal swing of how life was pre-COVID. Now, I wanted to talk to you about our capacity building officers. So last time we caught up, we mentioned that our new capacity building officers would be starting very soon. And we're pleased to let you know that officially started their roles last week. So I think I met them this morning actually at 9 o'clock, and this is the second week of their induction. So a great group of people, really raring to go, and very much looking forward to meeting their teams and meeting the people that they will be supporting. So these staff will be working directly with key staff, including those in the homes, to help your family member or friend to develop their confidence and capacity and capability. Even during tricky times like these, we are seeing how the capacity building officers are making a difference. So one of the example of how they have actually started working even pre they officially started last week, but during the COVID period, they were the people who actually worked through the activity books that were put together and sent out to the houses, and the various ranges of activities that have been through the houses in the last 10 weeks, like the cooking and crafts and the various games to keep people busy and happy in their homes. And again, we've heard some great stories, and we've had some really good newsletter articles from people doing everything from 10-pin bowling to cooking and art and craft and all sorts of really lovely things. And a lot of the instructions for these activities have come through the capacity builders work, which has been really, really good. They will also be a key stakeholder in working through arranging the house meetings, and they'll be making contact with you all shortly, so as you can be involved in house meetings with your loved one and the staff who are there. So watch the space. That some of those house meetings I think have already been scheduled, but everybody, the anticipation is that, or the expectation rather, is that the house meetings, everybody will have at least had one house meeting within the next month. So if Toby's online, hopefully he's nodding vigorously and saying that that's correct. So we'll be working through that. We've also been continuing to work through our process improvement work. So it's well underway, and we're looking at officially having that all in place by the 1st of July. But really in the next during June, we will start rolling out what we're calling our end-to-end process. So this is about looking at all of our processes, mapping them all out. We've mapped them all out, and we've developed a holistic, consistent wraparound service for the people we support. So essentially, it's about updating how we work and our service to ensure the people we support have a fulfilled life. We will be keeping you updated as we go on what those changes mean and how they'll impact you and your family member or friend. And at a previous face-to-face forum, we've also flagged our baseline work, which we were calling the Establishment Project, to map out our staffing by area. So this is about having greater consistency with our staff, so there's less need to draw on the SDRO pool, and that we're pleased to let you know this project is making great strides forward. So really our whole aim about having the client at the centre and building secure teams around the client of staff who get to know people, build relationships, and that, obviously it's much better for the people we support and your loved ones to have people working with them who know their likes and dislikes, and work through having the best life. So briefly, just on a few other points before we move to taking questions. So the client influencer group has now met twice online, which has been really great. It has been a bit of a challenge, but also great for some of the people we support to see each other online and to have a chat, because obviously people haven't been able to catch up during the COVID time. The group recently provided some terrific feedback on the customer charter via a poster. So Lindy, are you able to share the customer charter online?
I will see if I can. It will be my technical inability that will prevent that. So just bear with me. I'll try doing that.
No worries. So the charter is nearly finished, and it will be circulated to you very shortly. And it details what can be expected from our service and how we will be more consistent across some of the key business areas. So we'll be very excited to provide that to you and to the people we support. So I think when Joe and I caught up face to face, maybe the last time, we talked about the customer charter, and it's very much about us spelling out what our customers, what the people we support can expect from us by way of a quality service. So it was really interesting, getting initial feedback from the client influencer group just around what was important to them and what sort of things that they would like to see from us as a service. And when Lindy gets it up on the screen, it's around looking at, what sort of supports would you like? It's about people having privacy was one of the big big ticket items that some of the people brought up. You know, having privacy, being respected, being listened to, and really having a say in their life. So it was a very, very powerful conversation with the influencers group, and we're really, really keen to share it with more of the people we support and get their feedback, and also you as parents and guardians. So.
It is coming. It may just be a delayed. So when it's available, I'll let everybody know.
Not a problem, not a problem. And it's certainly something that we can send a copy out after this meeting as well via email. The other thing that we're doing, oh, here we go. Is it coming? Yes, here we go. So just looking through, so it's obviously what we have up on the screen is our easy read. So basically it's around working with the people we support around, you know, what their rights are in a very easy to understand format. So there are 12 boxes there, and as you can see, you know, some of the feedback we got with this is my home and it is my right to be respected, be listened to, make my own choices about what goes on in my life and where I live and who I live with, and be involved in decisions about me, talk about problems or make a complaint. So that's something that we really need to start taking very seriously. Feel safe in my own home, you know, basic human rights that people feel safe in their own home, and be given an opportunity to learn and experience new things. And privacy was a very big ticket item when we spoke to the group around having privacy in their own rooms and also privacy in the bathroom. And wear clothes that I look good in, fit me properly, and are comfortable to wear. And we talked about a whole range of things there, from, you know, having your clothes, you know, ironed, you know, not wearing clothes with stains on them, you know, changing clothes if, you know, the person has had an accident with eating or drinking. And certainly that positive self-image was something that was certainly talked about quite a lot. You know, ladies who like to wear makeup, you know, that they're facilitated to do that if they can't apply it themselves, and actually having staff who are available to sort of do that. The other thing that was very key to our conversation was around having access to yummy, healthy, nutritious food. So certainly that is something that I have certainly talked to lots of families about over my time as director, looking at the nutritional value and the fresh food that people are eating on a daily basis, and having access to snacks that aren't sort of convenience food or you know, frozen, less packaged foods and things like that. Also be involved in changes that are happening in my home. So again, you know, people having a say around who they share their homes with. You know, if there are people who aren't happy, you know, in the shared arrangement, you know, what are their opportunities to sort of give feedback around that and have that changed. And the last point is to be presented to the world in the best way possible. So again, you know, really having individuals, you know, having their own stamp on how they want to be presented to the world, and actually not taking on the personality, if you like, of the carer who happens to be the person who supports to purchase clothes and things like that. That actually they're individuals are able to be exactly that, individuals in their own world. So I think this will be a big step into us having different conversations with the people who live within our service, and certainly, you know, changes our lens as a service provider in terms of really having the people we support as partners in their care and partners in their support. So there will be lots more on this in the coming weeks and months, and that will be led by Lindy's team. We're also finalising the org chart that a number of you have asked for, including pictures and names that outline the key staff in our structure. We think that will be ready, Lindy, by the end of the month. Is that correct?
Yep, it will be.
And we'll be sending that out.
Yeah.
So that's a bit of an overview. I mean, I didn't mean that to be an exhaustive list and talk through it really quickly, but I'm really keen to sort of get to your questions. So, Joe, did you want to talk through the Q&A piece?
Look, we're sort of open for questions now. So I think there was some that was.
Yeah.
Is that right, Lindy? So
that's right. We had a number of people email questions through prior to the forum this afternoon. So I will read them out, and Joe and Muriel, you can respond. Some of the topics we've touched on, but it's important information. So if there's some repetition, it's probably a good thing. So the first question is, are clients able to have overnight stays at family members' houses?
Yep, so that's an excellent question. So the answer to that is yes. So again, like anything, what we would ask is that if there are anybody in the if anyone in the household that the client is going to overnight has been interstate or overseas, we would ask that the client doesn't visit until the end of the mandatory 14-day period for those people who need to self-isolate. We would also ask that if somebody in the household is unwell, so again they've got flu-like symptoms, scratchy throats, not feeling well, that the client wouldn't go home. Equally, if the client themselves was unwell, we would again ask that the client wouldn't go home. But if everybody's well and there's no reason in the world why you can't have your loved one or your family member home for a weekend or a mini break across South Australia over the next little while.
Okay, thanks, Muriel. So are clients able to go to places such as shopping centres and hotels, restaurants or cafes?
Yep, again.
You go.
Sure. Again, yes, so we are following the SA Health guidelines. So the same rules apply to our clients as apply to us as the general SA society. So obviously we moved into the next stage of COVID-19 today. So, there's obviously new restrictions around hotels and shopping centres and cinemas and all of those sorts of things. So again, we'll just go through the exemption process to make sure that the person who's going into these areas understands the 1.5 metre social distancing, the hand washing, the fact that, what the rules are around cinemas and restaurants and all of those sorts of things. And what we will say is particularly around people who don't tolerate crowds well, again, we'll make an educated guess, I guess, around whether it's, what's the best time to go to these places and really take our cue from the person in question in terms of how they're actually going to manage with going into a place. And what we were asking staff to do is, if people can safely socially distance, then absolutely there's no issue. But if they arrive to a shopping centre and it's absolutely, been overrun with people and people aren't actually managing the social distancing as they should, that we're asking people to retreat. So fundamentally the answer is yes, but following the same guidelines as everyone else.
Excellent. Thanks, Muriel. Okay, so the next one is, can you please cover the existing and changing protocols for visits to homes by service providers, and who will take responsibility for communicating this within DHS?
So I think Muriel sort of outlined the exemption process before, and certainly in terms of service providers come into the house, there's a process to go through in terms of the survey that we're asking anybody to come into the house to do so. If people are going out to activities like day options and other things, then we are working with day options providers to understand their social distancing arrangements and guidelines in place. But in terms of responsibility, I guess we're certainly ensuring a safe place within the homes, and then outside of that will become the service provider's responsibility and how they work through that. But again, we're trying to work with them to understand what they've got in place, and working with you as families and guardians to work through any issues that we are aware of.
Thanks, Joe. There's a second part to this question that touches on what you've just spoken about and asks if approval is required. At what level within DHS is that decision making occurring?
So it's just about what particular, what question and where that's sort of going. But certainly from a service perspective, we're implementing those arrangements around people coming into the service at this level. But on an individual circumstances and exceptions, that's managed at an area manager level. If there's exceptions outside the normal kind of protocol, but that's been in place since the start of this as well.
Excellent, thank you. And again, these next couple of questions are also touching on day options and activities outside of the house. But the question has been asked is, when will clients be able to attend day options? Is there a date?
So look, people are attending now, I'm pretty sure, Muriel, in some cases. So look, we are working with day options providers as soon as they're ready and have appropriate things in place, then clients can certainly access that. We do know that there is one provider, but there might be others that are sort of still working through their arrangements for various reasons, and that might be because of staffing spaces, or because of transport, or because of actual facilities that they need to have in place to put inside the guidelines. So it really depends on a lot up to them, but certainly from our service, there's nothing precluding that arrangement. Mira, did you have anything else to add on that?
No, that's correct. So again, it's an individual basis, and certainly the day providers have been contacting the various houses last week, just talking about, yes, they're getting ready, and they're getting ready to ramp up services again. So I think we will see a number of people returning probably this week and next week, where it's safe to do so. So yeah, I think people will be very, very pleased. Particularly, I think Windermere is opening shortly again. So I think some of our residents will be very, very pleased to get back into their day activity schedule.
And again, on this topic, the question has been asked if providers can come into the house to provide one-on-one support to people.
Yep, absolutely. And I think, as Jo said, some providers have been providing that one-on-one support throughout COVID, again, where it's appropriate and where it's safe to do so. And yeah, we'll continue to encourage that, as the needs arise.
Mm. And again, on this topic, the question has been asked that the reasons some organisations have given as to why they haven't been able to continue with day activities through the COVID period is because of the nature of the disabilities, and people have been told that it's because they can't ensure that hand washing can be adhered to. So the question is, are there any discussions going on between DHS and these services to address the PPE hand washing issue that may have stopped some services, providing a service during this period?
Yeah, so look, I mean, we've been working with all of the people who live within our services to try and actually, we've done lots of different hand washing programs within the houses to encourage the people we support to get, particularly those who find it challenging to carry out hand washing, to do that. I don't think that that's specifically why people would have ceased services over the last little while. However, we are working with the day providers to ensure that they have adequate hand washing stations in place and those sorts of things. The day providers have been very much looking at their numbers and looking at the various venues that they have available to them to deliver the services as well. So I think some of the delay has been there. All of our day providers would have access to appropriate PPE, when PPE would be required for for somebody. Now, if somebody was COVID positive, they obviously wouldn't be attending the day service because they'd be in isolation. Yeah. Hope that answers the question.
Excellent, thanks, Muriel. So the next question is, what is the protocol if a client is either suspected or awaiting a test result or is confirmed as COVID positive? And the second part is, where will they be isolated? Will they go to hospital? Will they be quarantined within the home? Can you give us some info on that?
Do you want to go?
Yeah, that's fine. Yeah, yeah, absolutely. So look, we and I think I said this at the last catch up as well. So as soon as if we had a suspicion that somebody if somebody within our service was unwell and medical advice was that they actually needed to have a test for COVID-19, we actually have a system in place with our community nursing service, where the community nurse will assess who the individual and assess where they live, etc., etc. We'll have a very tailored approach to what happens next, depending on where the individual lives. So obviously, if the individual lives on their own, then that's fine. They can be isolated at home while they are awaiting the test results. If they are living with one other person, again, we'll assess whether the individual is someone who would be able to isolate in their room. Is there a second bathroom? And we would assess that. And then obviously, if we have somebody living in a house with, more than one other person, then we would assess that. So if the individual themselves can understand what's happening and understand how they actually need to self-isolate while they're waiting the test, the community nurses will go out and train the staff and train the other residents in the houses around what the appropriate PPE response is in that particular situation. If the situation is where the individual who's been tested can't understand and can safely isolate from the other members of the home, then we would obviously address that situation by either moving that individual, if that's what's appropriate, to an area where they can safely self-isolate while awaiting the results, or we would move the other members, depending on which is most appropriate. Obviously, we would do that in consultation with all of the families involved as well. Now, then obviously, if we had somebody who was COVID positive, there's a whole range of things that would be put in place then. So it may be that the individual is hospitalised, depending on what the medical advice is, or it may be that the individual would go to a particular place to be isolated for the duration of their COVID-19. But obviously, the response will be different based on who it is, what their level of understanding and compliance is, how ill they are, and all of those sorts of things. So again, it's not a one size fits all, and we have probably 6 to 10 different responses depending on where it is. So it's very much a tailored approach to the particular situation. And just to sort of add, we as an organisation, so we haven't provided a whole range of PPE to each house. The reason for that is the community nurses we have it all in a central location. So we have the masks, the gloves, the gowns, all of those sorts of things, that the community nurse will, within an hour of receiving the phone call, actually go to that particular house, train the staff, train the clients, and assess the situation in terms of what's needed, and prescribe the appropriate PPE for that situation. But we have a significant stock of PPE in place to address that. And we also have a 24-hour community nursing service during this COVID-19 response. We also obviously take our guidance from the Chief Medical Officer, and we have really, really strong relationships with SA Health. So all of our clients who have needed to be tested, we've had all of their tests fast-tracked, and really to limit and minimise any delays at all in the testing process.
Great, thank you. Now, this is not so much a question versus some feedback that we've received. I'll read the information that we've been given. I recently visited my brother-in-law at his home and was very impressed with how we were both engaged at the entrance to his home. My brother-in-law wheeled himself to the front door and opened it with the staff member behind him. There was a table to the left with a clipboard, iPad and hand sanitizer. The staff were very polite and kind and asked if I would sanitize my hands and fill out the survey. They went into detail about the survey and how to do it to help prevent the spread of COVID. My brother-in-law also said, yeah, you have to do it. It was really good to see a standard of healthcare throughout that was consistent. Thank you. And again, in that same vein, I'm very grateful to DHS Accommodation Services South for all the care and support shown to my brother-in-law. My brother-in-law is in his early 60s and lived in many facilities with limited support over the years. So since being in accommodation services for the past 3 years, his life has opened up with so many opportunities for a normal life. Being able to shop for the first time in his life and have a fridge and pantry full of food he picks from the shelf and puts in his trolley to stack in his own fridge and pantry is something that he is extremely proud of to show visitors. Thank you, accommodation team.
It's terrific. Thank you.
Yeah,
That's
it's good to hear. Now that's it from the questions that we received prior to today. We've just had one come through. So Joe, can you see that?
Yeah, so I can see that. So there does not seem to be consistency around directives relating to taking clients out to go shopping. Depends on which site supervisor you speak to. My loved one has still not been taken grocery shopping and has had his haircut appointment last week cancelled due to COVID isolation policy. This seems to contradict what Muriel said about going to shopping centres. So yeah, it does contradict that. And so look, we happy to follow that up. Particularly, so if you
I can touch base.
Yeah, so if you can do that, Lindy,
yep.
and then we'll follow it up directly with the site to
yep.
To make sure. But certainly in any next correspondence we put out to the homes, but we'll remind our area managers as well around that, just to re-emphasise that people can move about and move into community as we can as citizens. Any other questions want to pop up there on the screen? I don't know, we might need to trial next time that we can have a gallery view so people can ask questions live. We'll see how that goes. It's nearly 40 people on, so we've run a session with a department with about 100 and that seemed to work okay. So perhaps we'll try that next time. Look, if there isn't any other questions, then look, we'll sign off. But just really, so we'll probably do another one of these. Look, we'll see how things transpire, but we are certainly looking to move these to a more regular slot of about once a quarter. And if we can do them face to face, we'll try to do that as well as doing something virtually, just to give as many people access to asking questions and hearing us as well, and also to be able to record it. But really wanted to say thank you to, oh, here we go. Are parents able to visit Tennyson clients yet? So yes, that's able to occur, as like any other house, and as Muriel kind of outlined before, certainly encouraging families and friends and visitors can visit, obviously with the maximum number of people, though I think that's gone to 20 today, hasn't it? So that might be a bit too much to fit in a house, but certainly encouraging families to visit when they can, and just again adhere by the social distancing with our staff and other people there as well. So yeah, look, so we've recorded this session today and we'll be up online soon about. Look, we'll plan, we might have one in early July, but we'll let you know the details. Otherwise we might move them to a more regular slot of around a quarter by quarter, but certainly as we need to engage with you and consult with you on different changes that are coming, not only COVID, but other reforms that we're doing internally, a bit like the customer charter that was outlined before. And if you have any feedback, by all means, email that in, and we'll be doing that through other means as well and other channels. But if you have any other questions, please certainly talk to the service coordinator, your team leader, if you have any questions, or connect in with others who have set up this this forum. So thank you and have a very good afternoon from us.
Thank you.
Bye for now.
Thank you. Bye-bye.
Bye.